Are you relying on over-the-counter anti-inflammatories or painkillers to get through the day? Here are 3 natural supplements that your doctor that's handing you that ibuprofen for your joint pain probably hasn't heard of before. I'm a pharmacologist that specializes in natural supplements, so I got your back. The first supplement I want to talk about is apigenin. So apigenin is a bioflavonoid found in things like parsley, celery, and even chamomile tea, but you can concentrate and purify this and take it in higher dosages. So what apigenin does is that it helps regulate something called NF-kappa B. So imagine if you have your cell here, and then you have your DNA. Now, what this does, NF-kappa B is actually a transcription factor that binds your DNA and tells your DNA to make more inflammatory genes, more inflammatory proteins. So when apigenin can block this and bring down these levels, one of the genes that it helps bring down, and it down-regulates this enzyme, is the COX-2 enzyme. This COX-2 enzyme is actually the same exact target that NSAIDs like Tylenol or ibuprofen, Advil, these over-the-counter pain medications, they actually block this as well. So apigenin, instead of blocking what's there, it just helps your body make less of it. And if you have less of this, you'll have less of something called prostaglandins. These are a major player in inflammation, including joint pain. So apigenin can help lower these prostaglandin levels. Now, the second supplement I want to talk about is pycnogenol. Think of this as the collagen protector. So this does have some good anti-inflammatory properties. And what's really, really interesting is that let's just say, this is your foot and you have your knee here, right? And you have inflammation here in the knee. Now, pycnogenol has actually been shown to help lower oxidative stress and inflammation, specifically in the joints. In addition, it can also help boost blood flow and help reduce elevated histamine levels, which are a part of the pain response. Elevated histamine can lead to increased pain, and pycnogenol also helps reduce those. The third supplement I want to talk about is boswellia. So boswellia is very interesting because while we did talk about this COX-2 pathway, right, and these prostaglandins, boswellia actually helps with something called the 5-LOX enzyme pathway. And what this 5-LOX protein does, this enzyme, is that it produces something called leukotrienes. Now, leukotrienes, these are bad, right, for pain. They can cause joint stiffness. So the prostaglandins are one half of this pain inflammatory cascade, but the other half here are these leukotrienes. And what does boswellia do? Boswellia pretty much acts how Advil and other NSAIDs do with the COX-2 here, is that they help block this 5-LOX enzyme, so you have lower levels of these leukotrienes. And if you do some research, you'll see all of these different supplements here have data, whether it's in randomized controlled trials or mouse studies or observational studies, as actually helping with things like arthritis or chronic pain or osteoarthritis. So I hope you got some value out of this, and check out the caption if you want to learn more about looking at supplements through this perspective.